Hi, it's Jessica DaMassa with WTF Health. Joining me right now, I have the CEO of Cloudbreak Health. This is Jamey Edwards. Jamey, always a pleasure to have you.
The pleasure is mine, Jess. Great to see you again.
Thank you. So tell everybody what Cloudbreak Health is. You guys are in virtual care, but you have a different approach than most of the typical providers do to this. So talk a little bit about what you guys do.
Sure. Cloudbreak is a unified telemedicine platform that's currently in 1,200 hospitals across the United States.
1,200 now.
1,200 hospitals. We're doing 85,000 encounters a month at those hospitals. And we have over 10,000 video endpoints in the field. And what we really are is a healthcare disparity solutions business. And the first disparity that we solved was how you help limited English proficient and deaf patients get the same standard of care as their English-speaking counterparts. And what we've heard from clients as of late is, hey, how can we use your platform to do more?
Okay.
And so we've launched tele-psychiatry, tele-stroke, and other use cases. And we're allowing people in a very customized way to create their own telemedicine experiences now on the platform.
This is really cool because, first of all, I love the history that you guys have with the translation services. So I think that beginning of really solving for a really critical need at such a vulnerable moment for patients is something that has always set you guys apart. And now it seems like you have people in mind with this idea of bringing together these different services so that they can kind of customize what it is that they need out of telehealth. Say more about that.
Yeah, so one of the big problems I think that people have talked about with telehealth is adoption.
Yeah.
Right? Everyone's like, oh, why isn't telehealth being adopted? I can patently say telehealth is being adopted
Yay,
in a very
finally.
big way. And I think in the world of Teladoc and American Well and everyone else, seeing the Teladoc acquisition of InTouch, I think is a huge example of where telemedicine is really working. And it works very well in a B2B environment where we're actually trying to solve one of the disparities, which is physician shortages, nursing shortages, and shortages of other resources. And telemedicine does that really well. You can really shift the time and place of where a particular specialist can be and the impact they can have by bringing them in over a telemedicine encounter.
All right. So how are you guys moving forward? Because I think, like you said, the case has been proven for the utility of telemedicine,
Right.
all
Yes.
right? And now it's like we're looking at, even the conversation about parity and reimbursement is one that people are like, we don't even need to talk about that anymore. I think things are moving forward there.
Right.
So what's next for virtual care and for a company like yours in terms of the size and the scale that you guys have accomplished?
We think that the path moving forward is going to be enterprise telemedicine solutions. So telemedicine 1.0 was call your doc. Telemedicine 2.0 was let's add video to that encounter. But once that video was added, it was done with grants. It was with departments and hospitals making their own decisions around what platform they were going to use, and none of them were interoperable. There goes that interoperability word again. I'm going to bring it out to check it off from the bingo, matrix. But what we're really looking at now is what is a single platform solution that can satisfy all the telemedicine needs. And the cool thing about the language services use case, to bring it full circle, is that language services is throughout the entire hospital. So as an example, InTouch, which is a prolific, very high quality telemedicine solution, those guys do an incredible job. They have 4,000 video endpoints.
Okay.
We have 10,000 video endpoints because they might be doing a disparate program here and there. And they actually have done some great work in building out their enterprise infrastructure. Mm-hmm. So we have a lot of respect for them, and we're actually potentially talking to them about partnering. But we have these video endpoints that are already out there, 10,000 strong. And so our hospitals, like the Queen's Health System in Hawaii, have basically come to us and said, hey, we want to share our tele-psychiatrist with our other facilities. They're on other islands. But can we do that over your platform? And the answer to that is yes.
Absolutely.
So to us, Cloudbreak 2.0, if you want to call it that, right, is this next iteration where we're just going to continue to build use case after use case after use case onto the platform.
Okay. So do you think, as far as this market, and it's maturing, and I think that this deal with Teladoc acquiring InTouch is like one of these like seminal moments.
Yeah.
So what do you expect for the others? You guys you've been around for a long, especially if you consider the language business, you guys have been around for a long time. So what do you think is going to happen here as far as the virtual care startup? Are we going to be seeing any new entrants into the market? Do you think you're going to see more of a consolidation? What do you think is going to happen?
I think the X factor right now is what's happening with the EMR businesses.
Okay.
Right?
What do you mean?
Is Epic going to come out with their own telemedicine solution much more competitively, or are they going to do it through the App Orchard with the previous infrastructure that's already been put in place by folks like us in InTouch?
Okay.
So for me, seeing where Epic decides to go there is going to be really interesting. We've had great conversations with Epic and Cerner around how we get our services onto their platforms, and now it's like the magical world of the API. right? You have the opportunity to do so much more integration than you could do before.
Yeah.
And in this world of like web microservices, that's another way that you can integrate with all of these folks. So for us, the future is more enterprise telemedicine. I think when we see startups, they're going to be trying to attack a different issue than they attacked before. So you might have seen a startup go and attack a specific specialty and modality and say, okay, we're going to do prehab, we're going to do X, we're going to do Y. I think people are now looking for something that is a platform where you can now create new workflows off that platform to handle those types of things.
Do you really think it's going to be part of the workflow, the way that you just described? I mean, like that.
That's the
this
vision.
is like, I mean, truly, but like seriously, this is like something that we never even got to in terms of a conversation before, because it was like, we're just trying to get integrated into hospitals, and now it's like people are creating new workflows off of telemed. That would be amazing. How far do you think we are from that, or are we there, kind of?
I think we're getting there.
All right.
I don't think it's that far away. Seeing the work again that some of the companies have done in the space, that workflow component is critical, right? And one of the things we have to be careful of is not to force everybody into the same workflow. That really commoditizes the doctor, and doctors practice for a different way for a very different reason. So one of the things that we do is we actually go and study how they practice, and then we digitize that. This whole telemedicine thing, it's really just medicine going through a digital transformation. Right? So from that perspective, the future of that is, it's workflow driven, because that's how you activate the actual technology under it, and you activate the care is by making that workflow very easy.
Do you feel like you've gotten been having an easier time even talking to like the payers and the providers in terms of this? It's like it used to have to be like you have to introduce the whole concept. This was like not even that long ago. And so do you really feel like that people are looking at this as like, this is table stakes technology at this point? The same way we're using Slack, the same way that we're using email. Like it's like, of course we have to have that.
I would like to think so.
Okay.
I would tell you that even in the core language services market, only 50% of hospitals currently have video medical interpreting. So there's still a huge opportunity out there for these facilities that might not have gotten on the train yet to get on the train. But in the ones that have gotten on the train, there's just an incredible opportunity to further penetrate those clients with new use cases, and more use of the existing use cases. So there's a big opportunity there that's still hanging out there. And I think you're still going to see companies like Teladoc and American Well report amazing, and InTouch report amazing growth numbers, because this is starting to become a de facto part of how we practice medicine.
Jamey, we'll leave it there. Thank you so much for joining us. It's
that my
always
mic
so.
drop
I mean,
moment
that's your
right
mic drop
there?
moment
Okay,
right there. I
perfect,
should give it to you,
perfect.
but I'd probably get in trouble. Anyway, Jamey, it's always a pleasure. CEO of Cloudbreak Health. Check them out if you haven't. I'm Jessica DaMassa with WTF Health. Thanks so much for watching.